bit about the different approaches that we've seen regarding the exposome, and with a slight angle on the cancer research, because obviously we come from the International Agency for Research on Cancer, and that's part of what we do on a daily basis. So we've been very actively involved in the education and dissemination of the HEAP platform. There is the e-learning platform that's available through the IARC website, and that's available to all, but also developing some other tools of engagement, such as the personas that you can see an example of, some more educational material, not only on the dedicated HEAP platform, but also on the e-learning platform of IARC, and coming soon, the FAIR animated videos, which I have to thank the colleagues here for providing the interviews and for bearing with us through the process of scripting and rescripting and rescripting. Now, how do we approach the exposome? Well, the exposome is a relatively young field. If you do a very quick look on the PubMed with the exposome as the keyword that you want to find, that's what you get in terms of returns. So about the 200 to 300, 400 manuscripts. From the cancer perspective, about a quarter of them are directly related to cancer, and about another as many, quarter, are inferring relation to cancer, but not a direct correlation. So there are, of course, other topics. There's a very, very active discussion about tools, pathways, measuring devices, and so on. So cancer is a particular component of interest for the exposome. There are two reasons for this. One is a legacy reason, because Chris Weil was very active proponent of the whole concept and the idea. But also there is this expectation, this anticipation, academically, scientifically, that cancer research will continue to occupy a significant part of the exposome research field. Now, if we look at different locations and how they've approached this, if you look at the US, the first major investment that's been considerable has been in the Human Exposome Project, which very quickly morphed into the Hercules facility in the Emory University. And that got about $4 million 10 years ago. That was doubled 5 years ago. It's coming to a new renewal cycle that will continue to persist. But it's not in isolation. So the same agency, as part of the National Institutes of Health, that funded this program on the exposome, has also funded a whole number of repositories across the country, in particular focusing on early development and child health. So there is this anticipation of collaboration. So we spoke about the park just now, but this is mirrored on the other side of the Atlantic. In the European Union, the first two projects directly relevant or directly looking into the exposome were launched at IARC in 2012. And that was a very symbolic move by the European Union to do this launch at IARC, because Chris Weil was the director at that one. And there were Helix and Exposomics. Obviously now we're talking about the 9 projects that are part of EHEN, and a lot more considerable investment going in. But also, if we look in terms of the anticipation from the EU perspective, and I'm very, very pleased that we've just heard from Jana and Irene, the anticipation from the European Union is that this is not something that's come here for a few years and then it morphs into something else. Don't mind the funding, because this is just an estimate, but look at the timeline. The timeline is that this is anticipated to remain. So when we talk about the exposome, it's a commitment that they're making for at least another 10, 15, perhaps 20 years. So we've articulated the vision, and now we see that there is the buy-in from the funders, both sides of the Atlantic, to start to support this vision, and also supporting national efforts coalescing under this umbrella infrastructure. So what do national nodes look like? So we've had the launch of the Austrian national node yesterday, the Exposome Austria. That is very well organized. France is following behind, hopefully soon. And it's led by INSER, the Exposome and Heredity group. And it's based on the E3N cohort that started following 100,000 French women in the 90s, and now this has been expanded into the E4N cohort that follows 3 generations, so the daughters and sons of those original women, and collecting samples and data in very regular intervals. So the group that's responsible for that cohort and got the data and the samples is really driving a lot of the Exposome work in France. But we shouldn't forget the private sector, because what we're seeing is, yes, 10 years after the public health investment had started, but we start seeing investment by the public sector into Exposome concepts. So VC Laboratories in France has created a dedicated Exposome unit. And in particular, they're looking on the skin exposome. They've started providing awards 5 years ago. They call them the Exposome Research Grants. It's not a huge amount, but it's enough to do a proof of principle set of work. And the demand was so high that they had to triple the amount of money they put last year. And only last year they've received 86 applications from 36 countries. Almost all of them from Europe, so most of them from Europe, a couple from the US. Of course, this doesn't come by itself. They started having product lines to protect against the Exposome. You know, it's not just the academic, of course, there is the business element here. But we also have Kickstarters as the Exposome based on the direct-to-consumer approach. So you would have some sort of Exposome measuring device that will connect with some data processing center somewhere that will tell you that you've been exposed to some chemicals of note. This was promoted as a spin-off of Oregon State University in 2015. It failed at the Kickstarter phase. It needed a couple more iterations before it got money, but it's an incorporated company that's actively working on it. So I think what we will continue to see is a number of similar private investments into various aspects of the Exposome, but as the field is not structured, I think these offerings will not be structured for now. So how can we make some predictions about the field, about cancer research? And one of the easiest ways is to compare to adjacent fields. So we can compare, for example, to biobanking. And I've pulled these figures because we are here hosted by BBMRI. And if we look at the compound aggregate growth rate of biobanking, it's about 5 to 7% per year. And this is a steady phase. This shows a mature field that continues to grow. This is good, but actually, if you look at it in terms of academic output, what were the 2 main points at which the field really started to grow? And the first one was when BBMRI started the preparation phase, because suddenly the community was starting to organize itself. And we started to see a lot more structure, a lot more mature discussions, and a lot more collaboration. And the second one was when the ISO standards started being developed, because collaborations are fine, but actually we started developing the common language to move forward. And I think we'll see something very similar with the Exposome. In fact, if anything, we'll see a much more intense growth for the exposome if we get it right. Again, for biobanking, the majority of research is on cancer, and I think that reflects very nicely with what we see with the exposome. So what do we see in terms of future challenges? I'm not going to talk about ethics because Everett Penn is going to follow immediately afterwards. But I think the data and the handling of the data is priority. If you read even on the private company propositions where they find the challenges, it has to do with data and the tools and how they manage the data that they have. And this is not surprising. If we look at the models for developing systemic capacity, the skills and the tools come at the top of the pyramid. So what do we need first? We need to have our structures in place. We need to have our staff, our infrastructure. We're getting this with the exposome. So I think the development of the skills and the tools will follow naturally. So another discussion would have to be about the education. How do we provide the educational opportunities in a concerted way so that the skilled staff are there to use the tools that are put out by the different projects. One final note, because I presented about VC Laboratories, which is a private company, and the competition. Also, I'm chair of the Healthcare and Social Care Innovations for the Institute of Engineering and Technology in the UK for a number of years. And we do our annual award ceremonies. Last year is the first time that we've had a submission about an exposome-related product. So even in the national level, in the international level, because it's an international competition, the exposome is starting to make some impact. From the IARC perspective, we need to make a plea or a note that we shouldn't leave low middle-income countries or resource-restricted settings behind. Because we did that with biobanking and it took a number of years to catch up. And this is one of the examples. We wanted to develop biobanking facilities, cohort facilities in low middle-income countries. IARC, together with the National Institutes of Health and other partners, had to do that. They had to create the network to be able to develop the standards that were already produced, train the individuals so that we can have representation of those samples into our cancer research. I'll leave it at that, and thank you very much for your attention.